Hi, my name's Amy Andrew. I'm a professional boxer and I am 34 weeks pregnant.
And I'm Grace Keene. I'm a specialist pelvic health physiotherapist working at CHHP on Harley Street. So I work with patients doing anything around obstetrics and gynecology, and I've been working with Amy during her pregnancy.
So I have been working with CHHP for a while, like when I was an amateur boxer and professional boxer. And then when I was pregnant, I was like, I'm not really sure what I should or shouldn't be doing. I want to keep training, but I don't want to like hurt the baby, or, you know, what can I keep doing, or whatever. So yeah, I just thought I'd have a chat with you.
Yeah, definitely. I think when you came to me, you had some quite specific questions around your training, and then we sort of got off into a whole world of other things, didn't we, of kind of what people ask you when you're working with other people, and some of it is kind of dragged off the internet and no one really knows what's based in evidence and what's kind of just been written down, and you're sort of hoping for the best. So I think one of the big ones you asked about was running.
Yes.
And I get lots of people coming to me just like you did and saying, I've kind of stopped running, I'm not sure if it's good for the baby or not, I'm not sure if it's good for me or not.
Yeah.
And it's one of those ones that absolutely from an evidence point of view, in terms of safety, there's no big reasons that you can't run unless you've got some quite significant medical things going on, which are a bit separate and we can kind of talk about maybe another time. But most people will know that because they've been under monitoring with their doctors and things like that. But from a running point of view, if you've run before and you really enjoy it, then absolutely you can keep going through your pregnancy. There might just be some things to modify. Okay. So it might be that you don't go as far, or you don't run when it's the hottest point of the day, simple things like that. What we're trying to do is make sure you don't dehydrate, you don't give yourself any injuries, and that you're feeling comfortable and still enjoying it. I think that's the big one. If it's a slog and you're pushing through it, and you're just doing it for the sake of it, then it kind of comes down to that risk versus benefit. What are you doing it for? There are other ways to keep active and get your heart rate up if you're not enjoying running. I'd say the big things that are kind of a no-no, and we tell people actually maybe to stop running, is if they get an injury and that might prevent them being able to run, or if they're starting to get what we call pelvic health symptoms, so things like leaking urine, or getting lots of heaviness down to the vagina. And again, they're not categorical, you can't run anymore things. There you need a bit of support, and maybe a pelvic health physio is the right person to improve some of that before we get you back out there. But there are some people that run right through their pregnancy. For other people, that last couple of months is a bit too much and they feel really uncomfortable and have to stop.
Yeah, because I did it for about 5 months, and then I was like, oh, maybe I can just like slack off the running because I always have to run so much. And then I gave it up, and then I really missed it. So then I think it was like I was 7.5 months pregnant, and I was worried that because I'd given it up that I couldn't go back to it. And then you were like, no, it's all good. So
I think when we had a look at you, there's no big reasons to say why you couldn't. It's a bit of a trial and error thing after that. If you enjoy it, get out there, it feels good. And again, you haven't got those negatives going on, then why not?
So I'm back on it.
Which is great. You've done really, really well.
What else are the like other myths and stuff that people kind of, because I read a lot of stuff and then they're like, don't do this, or like lie on your back, or don't lie on your back, or you know, what else?
Yeah, I think the lying on the back one's a really common one that people come to me with, and often that fits in quite a lot with being able to do abdominal exercises or core exercises, they're sometimes called. And that lying on the back thing is really about sleep. So when you're asleep at night, ideally you don't want to lie on your back because you're not aware of how you're feeling, you're out for the count, hopefully you've slept well, and it's that pressure, so on kind of some of the venous blood return to the mum, and also some of the blood supply that's going around to the baby. So it's that sleeping and not moving element that's the real risk. I often compare it to people, if you're thinking about exercising on your back, or for example doing a bridge, so lying on your back and lifting your hips up in the air, because you're moving, that's an okay thing to be doing as long as you feel comfortable. And sorry, the comparison I was going to say is if you go for a scan during your pregnancy, often you're laid there for quite a while whilst they're checking everything. And because you're compos mentis, you're with it, you can see how you're feeling, you're not starting to feel dizzy or unwell. That's a safe thing to be doing. So as long as you feel comfortable and happy doing it, and there's no one's told you any reason why you definitely can't from a medical point of view. As long as you're awake and you're moving, then it's a safe thing to do.
So with core and stuff, because I feel like obviously part and parcel of being pregnant is you're going to like lose your abs, which is cool. But then like, how do you get them back? Like obviously so then I was like wanting to do some cool stuff, but then I was like, oh, what if, I don't know, basically I don't know anything about it, so I didn't really know
Yeah,
what to do.
definitely. So you haven't lost them, they're in there. I
Okay,
promise.
cool.
They're in there. But absolutely, during pregnancy, your main abdominal muscles, so what people kind of call their six-pack abs,
Yeah.
will separate a little bit.
Yeah.
And that's to allow the tummy to project forwards,
Yeah.
which is absolutely necessary. And that's for everyone. Everyone gets some separation
Yeah.
of their abdominal muscles.
Yeah.
For balance, to stay upright, to do exercise, you need your core. So
Yeah.
they're the muscles that sit slightly deeper to your main six-pack abs.
Yeah.
Your pelvic floor muscles, which sit in the base of the pelvis,
Yeah.
your obliques and some muscle in your lower back, and right down your lower tummy kind of form that, what we call a core cylinder.
Okay.
And those muscles you can still train during pregnancy.
Okay.
And we can maybe have a look in another chat about some specific exercises you can do to work
Cool.
those muscles. What you really want to avoid in pregnancy is anything that looks like a crunch, so that typical sit-up,
Okay.
V-sit,
Yeah.
crunch position.
Yeah.
For most people it doesn't feel good, it doesn't
Yeah.
feel nice.
Yeah. Yeah.
Plus, it's just lots of pressure around the tummy,
Yeah.
which puts pressure down into your pelvis, and
Yeah,
that's one
yeah.
of the big things we want to avoid in pregnancy.
Okay.
If we're doing lots of tensing and pushing from here,
Yeah.
the only way that energy can go is down
Okay.
onto your bladder, onto your pelvic floor,
Yeah.
and that doesn't feel nice, and
Yeah,
that's
yeah.
what can then give people some of those pelvic health symptoms,
Okay.
like urine leaking or heaviness into the vagina that you want to avoid.
Yeah. Cool. What other myths are there?
So I think kind of going off the back of the pelvic floor side of things, if you imagine your pelvis, this big basin, at the bottom of it you've got this bowl of muscles called your pelvic floor muscles. A lot of people haven't heard of them until they have a baby, because
Yeah.
then everyone's kind of talking at you about them.
Yeah. Yeah.
But they're something you can exercise throughout your
Yeah.
life, and it's quite important to exercise them, and we want to keep them nice and strong. So throughout pregnancy, the technique of trying to squeeze and relax those muscles typically every day is quite important. And the idea is that you're trying to think about trying to stop yourself from passing urine and passing wind. That's the
Okay.
action that you can kind of visualise as you engage those muscles and let go.
Cool.
Yep, really exciting stuff. And then there's other ways we can make it more interesting, but at its root, that's what we're basically trying to achieve.
Okay.
Lots of people are told that, or they read that towards the end of pregnancy you should stop doing them, because if those muscles are too strong you won't be able to deliver baby vaginally.
Yeah.
But actually that's a bit of a fallacy as well.
Okay.
So on the day when all the hormones kick in, if you're going to labour naturally, your body will help those muscles relax and
Yeah.
baby will be able to come out. So there's more value in keeping exercising those
Yeah.
for as long as possible.
And you said something about a C-section, like if you have a C-section you should still do it. But I feel like you're just like bypassing that, so you can just like, you know,
Skip
not
'em.
do that. Yeah.
Get rid of them.
Yeah.
So absolutely, your pelvic floor is taking the same strain, particularly if you've been
Okay.
exercising and running during pregnancy, which again is not a negative, but those muscles have to work really hard.
Okay.
The amount of gain in weight we have over that 9-month period is quite
Yeah.
dramatic, really.
Yeah.
It's a good thing, it's meant to happen, but those muscles are doing a lot of the work to keep
Yeah.
everything supported and look after your
Yeah.
pelvic organs. So whether you have a cesarean or a vaginal delivery, those muscles have worked really hard and they need that support. The only slight kind of adjunct to that, where people might not need to do as much or might need a bit more assessment before they do lots of pelvic floor exercises, is if they've got any sort of chronic, what we call chronic pelvic conditions.
Okay.
Things like endometriosis, or things like having had vaginal pain when they've had inserting tampons, having penetrative sex, or having smear tests, and that might be an indication those muscles are actually very high tone,
Okay.
or I've got quite high tension is probably a better word
Yeah.
for it, and those muscles are already very tight, and actually they need a bit of work to do some letting go.
Chill out.
Yeah, it's
Cool.
a little bit less common, but it can happen. So if you think you
Okay.
fit into that category, then it's worth having a chat with a pelvic health physio,
Yeah.
which you can see privately or on the NHS, and just understanding a bit better what's going on for you before
Yeah.
doing loads and loads of strengthening work.
Okay.
But
Cool.
for most people, they're important muscles to exercise regardless
cool.
of how you deliver.
So you can run. You can. You should do pelvic floor.
Yep.
You can do core still.
Yep.
What else?
So I'd say it's come on a long way. A few
Yeah.
years ago, people were told, or more of the understanding, once you're pregnant you shouldn't do anything.
Yeah.
Actually sitting still and resting lots was a good thing.
Yeah.
For some people that's fine. If they want to kind of do a bit less and strip things back, that's not a problem. The evidence does say, I think you said you were reading a book about kind of some of the data that's out there,
Yeah.
that there's not necessarily huge changes in outcome for women whether they do lots of exercise or they just keep active.
Yeah.
The key thing is being active, so
Yeah.
moving, not
Yeah.
sitting still and
I would
doing
get really
nothing.
bored.
Yeah.
So for me, it's just like, it would be weird not to do exercise. So
Yeah, definitely.
I wanted to carry on doing stuff. Are there other things that, you know, because I guess people are told don't start running or don't do this or don't do that, but you can?
Yeah, you can. So you can start new forms of exercise you've not done before during pregnancy. If you're someone who's never exercised, then absolutely you can start exercising.
Okay.
It's just about understanding what exercise looks like for you, and the key is that you enjoy it, you're keeping active and you're being safe. So we try and tell people not to do anything extreme, so I wouldn't start marathon training or heavy weightlifting if you've never had any experience of it. If you've done it lots before, like for you in your career, boxing, there's still lots you can do around sparring and kind of working with professionals who know how to make sure you're training well and not kind of doing yourself any damage. So that's absolutely fine, but I wouldn't necessarily advocate someone started boxing during pregnancy unless they had a real desire to do it and wanted to do kind of like a gym boxercise type class where you're not punching anyone. Or maybe they have like a lot of aggression.
Yeah, maybe. Just want to get it out, you know. I'm not sure.
And it's a safe environment to do it. But it's about that enjoyment factor. I think that's always the big one. And the other thing that I think in terms of reassuring yourself that you're doing a good thing by exercising is a lot of the evidence is that the babies end up much healthier. So once they're born, and then when we look across a child's life, kind of early years lifespan, they tend to do better, they tend to be more active, healthier, all those sorts of things. It's not to say that won't happen if you're not active, it's not to kind of scare people into exercise, but a lot of the research does suggest that for mum and baby it does kind of cause better outcomes. And mental health wise, I think it's a real positive as well, keeping active. And
unless you hate exercise, I think you were saying before, in which case it will damage your mental health if you do spinning
if
or
you're
whatever.
forced into yoga. Yeah, I think they're probably all the biggest myths that people come to me with.
Thank you very much.
That's all right. Thanks for chatting to me.